You're all done getting that new jawline sculpted, but do you know how to take care of it after so you get the best results? Before we get started, this video is for my post-op patients, so if you are not one of my patients, then I recommend you follow your surgeon's instructions, because that's going to be key. All right, let's talk about it. Why are we massaging after chin lipo? I thought the lipo just did all the work to get me my results, right? Well, yes and no. The lipo evacuated the excessive fat that you may have had underneath your chin and along your neck, but it's going to lead to swelling and some scar tissue. So we have to address the swelling and the scarring during the first few weeks after your surgery to get the best results. So when do you start massaging? Well, I ask my patients to wait 1 week before they begin massaging. The reason being is that all of this skin has separated itself from all the structures below. So I want all of that tissue to have a chance to begin reattaching itself over the week that follows. Plus, it's not going to be comfortable at all during the first week, so let's just let the compression garment do its thing for the first week. Some people think that they need to see a lymphatic massage therapist for this procedure, and if you really want to do that, by all means, please do. But the massaging is in such a small area, and you can do it more frequently if you do it yourself. I ask all of my patients to begin massaging 1 week after surgery and to massage about 3 times a day for about 10 to 15 minutes at a time. How hard should you press? I want you to massage with enough pressure to be mildly to moderately uncomfortable. But keep in mind, this is not going to be fun during the first couple of weeks, but eventually it will get better. I recommend using your hands to start at the cheek and chin area and gently massage back towards the ear a few times. So you're gently going to take your fingers and everything and just kind of push everything back towards the ears, okay? Next, you're going to take 2 fingers, 2 to 3 fingers, and starting under the chin, and then you're gonna massage back towards the area just below the ear right here. So I want you to really just kind of run everything back. Next, you're gonna go down the central portion of the neck a few times, and then you can take your thumbs if you really wanna get in there and really massage it, okay? And you're gonna run down the central part. Lastly, we're gonna focus on the outside portions of the neck to really get all that fluid into the lymph nodes and back into your circulation to get rid of it. So the majority of your lymph nodes are on the sides of your neck. So massaging with good pressure out here and down really helps to get that fluid moving. So take your fingertips and start below the ear and drag down the muscle that's called the sternocleidomastoid, okay? So really kind of get some pressure on there and really work that going down. So remember, you're gonna do this for about 10 or 15 minutes at a time. I want you to repeat starting at the top, work your way down, and once you do a few passes through here, start back up here at the top again and just work your way down. It's not gonna be comfortable, it's not gonna be fun for that first week, but eventually it will get better. Now this is the massaging that you're gonna do for the majority of the time that you massage. Starting around week 3 or 4, you're gonna start doing something called marble rolling, or that's at least what I like to call it. What the heck is that? Well, around week 3 to 4, everyone gets lumps and bumps that they can feel. It feels like some marbles underneath their skin where the lipo happened. This is totally normal and can last for a few weeks after the surgery. So when this happens, you're going to grab each of those little lumps and roll them between 2 fingers to help break them down and help them go away. You should be mildly uncomfortable, maybe moderately uncomfortable when you do this, so that way you know that you're doing it right. Then the last question you might be asking yourself is, how long do I have to do this for? The majority of your swelling will be gone by about week 6, but I want you to keep massaging until your skin in the lipo areas feels as nice and soft and pliable as the skin in the areas that we didn't treat. The reason being is that I want all of that scar tissue to be nice and soft, so if there's only minimal evidence we did your chin lipo, and all your friends can give you that look and go like, there's something different about you. I know, there's something different. It'll be our little secret. Oh, and if you had buccal fat pad reduction along with your chin lipo, like in this video right here, then these massage techniques work exactly the same. So I hope you learned something today. I'm Dr. Paul Pearce. I'll see you in the next one.